Stephen Correa, and I'm an associate professor here at the University of Georgia. And my role in the Care Center is I'm the director of neuropsychology and have a big role in helping develop and run the clinic that we have here, in addition to teaching and doing research. And I've been here for just a little bit over 2 years. What brought me to CARE was the enthusiasm that I had for the work that they were doing, and really the importance of the work that they were doing in trying to bring understanding of what dementia is and how to prevent it and how to promote healthy cognitive aging to rural, underserved communities in this big state, which has a lot of needs. And the opportunity to develop something that was really kind of a grassroots movement in a large R1 university was really appealing to me. Oh, in my role, it's pretty varied. It will jump from individual mentoring of some of our top flight research students to individual mentoring of some of our clinical psychology students, teaching classes, working on research projects, working on papers, working on grant development, maybe seeing patients or doing patient-related care, record reviews, fielding questions that come in on the phone from patients and so forth. So it's really quite varied. It feels like every 10 minutes I'm switching gears often. Yeah, so and I like that, actually. Helping others, and I construe that to be helping our students develop and grow, helping patients and their families understand what's going on with them and help them to improve the quality of their lives. And I'm in a position at the university where I help to mentor and coach some early career investigators and helping them develop and grow as well. I've been fortunate in my career to not only be a clinician, but to be a clinician researcher mentor. And I find it fascinating that I can bring what I know to, as I just mentioned in my last answer, help others. But that's a two-way street, because in doing so, I find it fascinating that I'm always learning something new. And then taking what I've learned to then improve how I help the next person who comes in line. So I find that to be fascinating and rewarding. One of the things that I've really learned that I didn't quite appreciate, having grown up and having worked and lived my entire life and worked in kind of a metropolitan kind of area in the Northeast, having moved here, is lack of resources there are in some of these rural places in Georgia. You know, where I grew up, it's like if you drove half an hour to get to someplace, you had to think about that. But here, things are everything's 2 hours away, and people really lack medical resources that are nearby. And that was amazing to me, really, when I came here. Just like, I knew about it, but to just really see and just how valued when we go into rural communities and talk and share our expertise with people, just how incredibly valuable that is for them and how well received they are. I think that was eye-opening to me and validating about the reason why I came here, to be able to provide that.